today, you have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACI.
Senator Angela Alsobrooks took aim at Health and Human Services Secretary Robert F. Kennedy Jr., accusing him not just of cutting critical public health programs, but of not even knowing what those programs are or what they do. If you care about how government decisions actually affect families, children, and public health, this is the kind of moment you need to understand, so make sure to subscribe for clear, no-nonsense coverage that breaks it all down.
Senator Alsobrooks.
Thank you so much, Mr. Chairman. Mr. Secretary, I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job, and you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely did.
And you will find I didn't say that.
That is absolutely what you said.
I was talking about science, and I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You can fire any working scientist, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign. Well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
no, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also,
as I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So that doesn't exist right now. It's been dismantled. That is a fact. that particular division, what you plan to do in the
There's
the fact
42
of the matter
divisions
is that
on
it's
maternal health. We consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
Oh,
part.
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the ones, the programs that you've.
You're unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. I see the time. Thank you.
Senator Bloom.
From the outset, Alsobrooks made clear that her frustration was not about ideology, it was about competence. She told Kennedy she had been listening to the hearing all day and repeatedly watched him struggle to answer basic questions about his own department. Her charge was blunt, that he appeared unfamiliar with the very agency he leads, even as sweeping cuts and reorganizations move forward under his watch. One of the most striking moments came when the discussion turned to the Safe to Sleep campaign, a decades-long public health effort credited with saving countless infant lives by reducing sudden infant death. This is not a minor initiative or a pilot program. It has been a cornerstone of federal child health policy for roughly 30 years. Yet Kennedy could not initially identify which part of HHS runs it. After some back and forth, Alsobrooks stepped in and named it herself, the National Institute of Child Health and Human Development, an institute named after Eunice Kennedy Shriver, a member of Kennedy's own family. This exchange revealed something deeper than a disagreement over numbers. It highlighted a growing concern among lawmakers that restructuring and consolidation inside HHS is being used as a label to mask the dismantling of programs that directly protect lives. When Kennedy described the changes as consolidations rather than cuts, Alsobrooks pressed him on the reality, pointing out that divisions overseeing maternal health, reproductive health, fertility, and assisted reproductive technology no longer exist in their previous form. And that distinction matters. When a division disappears, so does its dedicated staff, its institutional knowledge, and often its ability to respond quickly in moments of crisis. Consolidation on paper can still mean chaos in practice. The questioning then moved to the Centers for Disease and Prevention, specifically the National Center on Birth Defects and Developmental Disabilities, which supports programs tied to the Special Olympics. Alsobrooks asked whether cutting funding and staff there was a mistake. Kennedy insisted the programs had simply been moved under a different administrative umbrella and not cut. Alsobrooks responded with a fact Kennedy did not dispute, that funding had in fact been reduced. Throughout the exchange, a pattern emerged. Alsobrooks named programs, divisions, and missions. Kennedy responded with generalities about consolidation, efficiency, and media mischaracterization. For viewers at home, the lesson here is important because the way government leaders talk about cuts often obscures their real-world impact. When officials say nothing has been cut, but communities see services vanish, the gap between rhetoric and reality becomes impossible to ignore. If you want more reporting that connects those dots and explains what these policy choices mean beyond Washington, take a moment to subscribe. Another key moment came when Alsobrooks asked Kennedy about assisted reproductive technology. He initially framed it as a general reference to IVF, but struggled to identify where the program actually sits within the agency. Alsobrooks corrected him, noting it is housed within the CDC, again reinforcing her argument that he lacked working knowledge of core responsibilities. This was not a personal attack for the sake of spectacle. Alsobrooks emphasized that these programs affect real people, babies sleeping safely at night, families relying on maternal health support, individuals with disabilities benefiting from specialized programs, and researchers whose work saves lives over decades, not election cycles. By the end of her time, Alsobrooks made her position unmistakably clear. In her view, dismantling divisions first and figuring out consequences later is not reform, it is recklessness. And doing so without understanding what is being dismantled raises serious questions about leadership at the Department of Health and Human Services. This exchange matters because HHS touches nearly every American life, from birth to old age. Decisions made there ripple outward into hospitals, schools, research labs, and homes across the country. Oversight hearings like this are not just political theater, they are one of the few moments when those decisions are scrutinized in public. If you want to keep learning what is really happening inside these hearings beyond the clips and headlines, subscribe so you do not miss the next breakdown.